When people think about managing diabetes, they usually focus on cutting carbs, taking meds, and tracking blood sugar. And while all of that is important, what if I told you there's another piece of the puzzle that most diabetics completely ignore? It's nutrients, the right vitamins and minerals that keep insulin working, protect your nerves, and prevent serious complications. The truth is, most diabetics are running low on key vitamins that directly affect blood sugar control, energy levels, and organ health. If you're missing these, you're making diabetes harder to manage than it needs to be. In this video, we're breaking down the top 3 vitamins every diabetic needs. If you're constantly tired, dealing with body pain, or struggling to control blood sugar, fixing these deficiencies can be a game changer. And trust me, you'll want to stick around till the end because I'll also give you the best food sources and supplements to make sure you're getting enough of these essential nutrients every single day. Let's dive in. 1. Vitamin D. If you're diabetic, vitamin D is way more important than you probably think. It's not just about bones or immune function. It plays a huge role in insulin function, inflammation control, nerve health, and even protecting your organs. The problem is that diabetics are naturally more prone to vitamin D deficiency. This happens because of insulin resistance and chronic inflammation, which interfere with how vitamin D is processed in the body. High blood sugar and frequent urination also lead to increased vitamin D loss, flushing it out before the body can fully use it. On top of that, many diabetics don't spend enough time outdoors, reducing natural sun exposure, which is the primary way the body makes vitamin D. The situation worsens with age because an aging pancreas and liver struggle to activate vitamin D properly, meaning even if you get some, your body isn't using it efficiently. A vitamin D deficiency can be confirmed through a simple blood test measuring 25-hydroxy vitamin D levels. But beyond a test, your body gives you signs when your levels are too low: constant fatigue, muscle weakness, bone pain, slow wound healing, numbness, frequent infections, and brain fog are all warning signs. Some people notice frequent sugar cravings, mood swings, or unexplained inflammation, all of which could be linked to low vitamin D levels. When vitamin D drops too low, every major system in your body suffers. Fertility issues arise in both men and women. For men, low vitamin D means reduced testosterone and lower sperm quality. In women, it disrupts ovulation and estrogen balance, making conception harder. Libido takes a hit too because testosterone plays a big role in energy and sexual desire. The nervous system is affected because vitamin D is essential for nerve repair and protection. When levels drop, neuropathy worsens, tingling increases, and reflexes slow down. The kidneys work harder since vitamin D is needed for calcium balance. Without it, the risk of kidney stones and chronic kidney disease increases. Eye health declines as well. Low vitamin D contributes to retinopathy by allowing excess inflammation and oxidative damage in the small blood vessels of the retina, leading to progressive vision loss. At the cellular level, vitamin D is like a power switch for insulin sensitivity. It binds to vitamin D receptors in pancreatic beta cells, helping them produce and release insulin more efficiently. It also suppresses chronic inflammation by lowering pro-inflammatory cytokines, which are always elevated in diabetics. Another major function of vitamin D is controlling calcium transport inside cells, which is critical for nerve signaling, muscle contractions, and blood sugar regulation. If you want to boost vitamin D naturally, food choices matter. Cod liver oil, 1 tablespoon, is the most powerful source, delivering 340% of the daily requirement. Wild-caught salmon, 100 g, provides about 130%, while sardines, 100 g, canned with bones, offer 110%. Egg yolks, 2 large eggs, give 20%, and mushrooms exposed to sunlight, 100 g, contain about 40%, but only if they've been grown under UV light. For those who love gourmet food, some of the best high vitamin D meals include Japanese miso-glazed salmon, 180 g portion, which delivers nearly 150% of daily needs, and Norwegian pan-seared cod liver with garlic butter, 80 g serving, providing 300%. If food alone isn't enough, supplements can help, but not all vitamin D supplements are the same. Nordic Naturals Vitamin D3, 1,000 to 5,000 IU per soft gel, is one of the purest and most bioavailable options. Another great choice is Thorne Research Vitamin D/K2, 5,000 IU per capsule, which combines vitamin D with K2, an important addition because K2 ensures calcium is absorbed properly and doesn't build up in arteries.
2.
Vitamin B12. All right, let's talk about vitamin B12. If you're diabetic, you're at high risk for B12 deficiency, and most people don't even realize it. The biggest culprit is metformin. Yes, the very medication that helps manage blood sugar also blocks your body's ability to absorb B12 from food. Over time, your B12 levels start dropping without you noticing. High blood sugar itself damages the stomach lining, making it even harder to extract B12. The older you get, the worse this problem gets because your stomach naturally produces less acid, and B12 needs stomach acid to be absorbed. B12 deficiency sneaks up on you. You don't wake up one day and suddenly feel awful. Instead, the symptoms creep in so slowly that most people think it's just aging or diabetes complications. The biggest red flag is nerve problems. That tingling, numbness, or burning sensation in your hands and feet is a major sign your nerves aren't getting the B12 they need. You might also feel extremely tired, dizzy, or have shortness of breath because B12 is essential for red blood cell production. Ever feel like your memory is getting worse? Brain fog, trouble concentrating. Some people even start worrying they're developing dementia, but in reality, they're just low on B12. So, how do you fix this? Food first, supplements second. Animal-based foods are the only reliable sources of B12 because plants don't have it. Beef liver is an absolute B12 powerhouse. It gives you 3,500% of your daily need in one serving. Clams, 100g, are even better with 4,000%. Sardines, 100g, give you 350%, and salmon, 100g, packs 200%.
3.
Folate, vitamin B9. If you're diabetic, there's a good chance that folate, vitamin B9, isn't something you think about often, but it plays a crucial role in your overall health. Folate is a water-soluble B vitamin that your body doesn't store, meaning you have to keep replenishing it regularly through your diet or supplements. This vitamin is essential for many processes, from red blood cell production and DNA synthesis to cell repair and growth. Unfortunately, diabetes makes it harder for your body to absorb and use folate properly, which can lead to deficiencies that impact your health in ways you might not immediately recognize. How diabetes affects folate metabolism. For people with diabetes, managing folate levels is especially important. High blood sugar levels cause chronic inflammation and oxidative stress in the body, which disrupts the delicate balance of folate metabolism. This means that even if you're consuming enough folate-rich foods, your body may not be able to process or utilize it effectively. To complicate matters further, many people with type 2 diabetes take metformin, one of the most commonly prescribed medications for controlling blood sugar. While metformin is highly effective in managing diabetes, it comes with a downside. It can block folate absorption in the intestines, leaving you at risk of deficiency. Over time, low folate levels can contribute to serious complications, including cardiovascular disease, neuropathy, nerve damage, and cognitive decline. Boosting your folate levels naturally. The good news is that you can improve your folate levels through diet. Some of the best sources of natural folate come from whole, nutrient-dense foods. Leafy green vegetables, legumes, organ meats, and certain fruits are all rich in this essential vitamin. Here's a breakdown of some of the top folate-rich foods. Should you consider supplements? While a balanced diet is the best way to get your nutrients, some people may need additional support through supplements, especially if they have difficulty absorbing folate from food. If you are diabetic and concerned about folate deficiency, it's important to speak with your healthcare provider. They may recommend folic acid supplements or a specialized form of folate known as L-methylfolate, which is more easily absorbed and utilized by the body. Balancing folate and B12. One final note, if you're increasing your folate intake, be sure to monitor your vitamin B12 levels as well. Folate and B12 work closely together in many metabolic processes, and a deficiency in one can mask a deficiency in the other. Both are essential for nerve function and red blood cell production, so maintaining a healthy balance is key. Conclusion. For people with diabetes, paying attention to folate intake is more important than you might think. By incorporating more folate-rich foods into your diet and being aware of how your medications may affect absorption, you can reduce the risk of deficiency and support your body's overall health. Small changes to your diet, such as adding more leafy greens, legumes, and even organ meats, can make a big difference in how you feel and how well your body functions. Remember, taking control of your nutrition is one of the most powerful steps you can take toward better health and better diabetes management.